When is a parent born? When your world changes in a moment? Nani? Or when the moment is celebrated by all? When you start learning again? Or with a new role? Is it your child's first breath? Or is it just a feeling? Parents are born when they fulfill a responsibility.
Your child's umbilical cord blood can provide protection from 80 life-threatening diseases. Keep it safe with Asia's largest stem cell bank, Cordlife. One chance, one choice.
Good afternoon, everybody. A very, very warm welcome. Thank you for joining us for this webinar on preparation for labor and management of pain relief during labor. This session has been brought to you by Cordlife. Cordlife is one of India's leading stem cell banks. And myself, Sonali Shivlani, I am a pregnancy and postnatal consultant. I will be taking you through this session. The session has been facilitated by Dr. Aditi Ghai. Thank you, ma'am, for the opportunity. Ma'am will not be able to join us today as she would have her own emergencies to deal with at the hospital. So we will be taking all the questions towards the end of the session. If you realize you will not be able to speak during the session, so whatever questions you have, you can put it in the question box, which is on the dashboard. And we will address all your questions before we close the session, right? The session recording will also be shared with you. And it's about 1 hour in duration. Since it is about labor and labor management and pain relief and etc., it would be nice if your family members who will be with you during labor are also attending the session. So make yourself comfortable, maybe get your husband to join you and grab your bottle of water and we'll get started in just about 1 minute. Okay, lovely. So let's get started. As I already gave you a very short introduction about myself, I'm Sonali Shivlani. I'm from Mumbai. I'm a pregnancy and postnatal consultant. I have almost 18 years of experience in this space. I have worked with over 40,000 families as part of my programs, workshops, webinars, and etc. When the COVID pandemic hit, everything which was offline, that means we were, conducting these kind of sessions at various nursing homes, maternity facilities, etc., had shut down, and we were all home confined, including all of my mamas who could not attend such sessions. So the team at Cordlife was very, very proactive and prompt, and they've right from the time of the start of the pandemic in March 2020, they started organizing webinars of this sort so that all of the mothers who were sitting at home could still get the benefit of having their classes without the fear of being exposed to the COVID virus. Thank you to Dr. Aditi for giving us this opportunity of speaking to all her patients. And the topic for today is labor and delivery. I will be taking you through what happens during labor, what are the different ways that you can manage pain during labor, and all the different areas that can be dealt with as far as labor is concerned, right? Any questions that you may have even during the session, please put it in the question box. I will attend to all the questions after I finish giving my end of the presentation. Okay, so let's get started with preparation for labor and delivery, and most importantly, how to manage pain during the birth process. So before I even get into labor, because labor technically and labor and birth is the culmination of pregnancy. That means at the end of pregnancy, labor and birth has to happen. Otherwise, the pregnancy will not be completed. There are four main factors that we would say should be your focus, your focal point during pregnancy, because this will impact a lot of things, whether it is how your pregnancy health is, the development and growth of your baby, how your labor goes, and also how quickly you are able to recover physically and emotionally post delivery. So that's a lot of things, right? So pregnancy is normal, but still it kind of changes your body so much. It changes so many things in you, and it's a life changing event as well. So definitely it causes a lot of impact, and that's what we have to learn how to manage. And these are the four factors which will help you. One is a healthy diet. I'll talk a little bit more about it in subsequent slides. Regular exercise. Again, that's also something which we will discuss in a little bit. Myths. Now, pregnancy starts with myths. From the point where we say, okay, in the first 3 months, you should not share maybe the skin color of the baby, the shape of your stomach. Delivery can happen at any time in the ninth month. Whatever foods you eat are going to impact breast milk. So these are a lot of things which have many myths surrounding it. And because of most of these myths, you end up with a lot of stress and anxiety because you feel that you're not doing anything adequate. You think you are missing out and you are not being the perfect mother or the perfect parent that you want to be. So keeping that in perspective, making sure that you don't get pushed by the myths is very important. Making sure that you stay relaxed and stress free during your pregnancy, as you approach labor, during birth, and even in the postpartum period, you should try and focus on being relaxed and stress free. So let's start with talking a little bit about diet. Now, eating healthy, of course, if I ask mothers, why should you eat healthy? They'll say it's good for my baby. So yes, definitely. It nourishes your baby, but it also keeps you healthy. And it definitely helps to build your immunity. So in this current scenario, immunity is like the best word ever, isn't it? So to build your immunity, you need to also ensure that you are eating a healthy diet. Now, most of us know what is healthy, but there is another word out there which we call balanced diet, right? So balanced diet is when all the components of the different food groups are a part of your diet. So for example, if you eat roti sabzi, yes, it is healthy, but it is not balanced because you've gotten carbs, you've gotten the vegetables, but you have not gotten any protein, you have not gotten any calcium. So the diet is not a complete diet in that sense. And therefore, the concept of eating a balanced diet becomes very important. You also need to eat every 2 to 3 hours. Now, the baby inside you is attached to the placenta, and the placenta is pumping blood to the baby 24/7. It's a constant supply, which means the baby is eating constantly, correct? So, if your blood sugar levels spike or drop because of long gaps in your meals, that is also going to cause a problem to your developing baby. And therefore, you have to maintain your sugar levels. And that is why we ask you to eat small meals, but eat every 2 to 3 hours. Now, water becomes very important. Of course, it's for digestion. It's a great detox. It overall keeps your system flushed well. But very importantly, during pregnancy, it also helps to maintain the amniotic fluid levels. And that is something which becomes very important. So, if you drink adequate water, your amniotic fluid levels are maintained. And if your amniotic fluid levels are maintained, your labor starts only when you are full term. You generally avoid the problem or challenge of preterm contractions or preterm labor. So, drinking about 8 to 10 glasses, that is about 2 to 2.5 liters of water every day is very, very important. Last but not the least, in spite of doing everything in perfection, मतलब सब ठीक से कर लिया, you still need to take your prenatal supplements. So iron, calcium, omega-3, early pregnancy, you should take your folic acid and a multivitamin. So these are essentials, right? Very important because we just have a few short months जिसमें हमको perfect baby बनाना है, to make the perfect baby. And इसीलिए prenatal supplements आपकी diet को balance करने में काफी help करते हैं. So it should not be that supplements become the only thing which is balancing your diet, and it doesn't work that कि सिर्फ diet ही ठीक है, आपको supplements नहीं लेने. Pregnancy में you need to manage both these and you should not skip them. कई बार ऐसा होता है that certain supplements we are not able to digest, specifically iron. कभी constipation हो जाता है, कभी nausea feeling होती है because of iron. So you should discuss it with your doctor and you should consider a substitute because we cannot take a chance as far as the development of the baby is concerned. Now, regular exercise is definitely going to be helping to prepare your body for labor. You know, many people जो normally exercise नहीं करते, वो labor का डर है because labor में pain होगा तो pain कम करना है, तो इसीलिए body को prepare करना है, तो डर के मारे वो exercises शुरू कर देते हैं pregnancy के time पे. So yes, definitely regular exercise is important because it prepares your body for labor. बट साथ साथ ही आपके जो ये प्रेगनेंसी में एक्स और पेन्स होते हैं, जैसे बैक पेन हो गया, एसिडिटी हो गया, लेग में क्रैम्प्स आते हैं, इट विल हेल्प यू टू डील विद दीज एज वेल. एक्सरसाइज हेल्प्स अस टू रिलैक्स. सो आई नो मतलब एक स्ट्रेनियस वर्कआउट हो जाता है कि हम इतना वॉक करके आए, लेकिन एक्चुअली आप व्हेन यू अनमाइंडिंग, जब आप कूल डाउन कर लेते हो तो आपकी बॉडी ज्यादा रिलैक्स्ड हो जाती है, आपकी नींद बेटर होती है, यू टेंड टू स्लीप बेटर, एंड ओवरऑल जो बेबी का डेवलपमेंट है वो भी बिल्कुल सही होता है. अभी एक्सरसाइज, कोई भी एक्सरसाइज शुरू करने से पहले यू शुड कंसल्ट योर डॉक्टर एंड टेक परमिशन. सेफेस्ट एक्सरसाइज इज वॉकिंग, क्योंकि वॉकिंग आप कहीं भी कर सकते हो और उसके लिए आपको सुपरविजन की जरूरत नहीं है. सो रेगुलर वॉक्स 30 to 45 minutes इज अ गुड आइडिया ऑन अ डेली बेसिस. एंटीनेटल एक्सरसाइजेस भी आप स्टार्ट कर सकते हो अगर आपके डॉक्टर आपको ग्रीन सिग्नल देते हैं, बट ये अंडर गाइडेंस करें तो इट इज ऑलवेज बेटर. एंड नाउडेज so all of us are doing online classes and you don't even need to go out of your house, you can do them from the comfort of your home. And daily routine में कुछ breathing exercises जैसे deep breathing वगैरह है, ये आपको अपने रूटीन में जरूर डालनी चाहिए. ये कुछ एक्सरसाइजेस हैं जो हम लेबर प्रिपरेशन एक्सरसाइजेस बुलाते हैं. सो पहला इज स्क्वाटिंग. प्रेगनेंसी में आपका जो सेंटर ऑफ ग्रेविटी है, बिकॉज ऑफ ग्रोइंग वेट इन द एब्डोमेन, थोड़ा सा इम्बैलेंस होता है. सो यू शुड एंश्योर कि आप कोई अच्छे से सपोर्ट लेके दीवार के नजदीक या मजबूत कुर्सी, काउच के बाजू में ही ये स्क्वाट्स करें, ताकि आपको इम्बैलेंस की वजह से आपका इंजरी ना हो जाए. जो फुल स्क्वाट्स होते हैं जैसे डक वॉक्स वगैरह, ये आपको लास्ट के कुछ वीक्स में ही करना है. यू डू नॉट नीड टू डू देम थ्रू आउट द प्रेगनेंसी, बट हाफ स्क्वाट्स यू कैन स्टार्ट एज सून एज द डॉक्टर गिव्स द ग्रीन सिग्नल. हमारी रिकमेंडेशन तो जनरली होती है कि स्टार्ट विद 8 to 10 काउंट्स एवरी डे एंड स्लोली, जैसे आपकी स्टेमिना बिल्ड होती है, आपकी स्ट्रेंथ बिल्ड होती है, यू इंक्रीज द काउंट्स टू 50-60 स्क्वाट्स ऑन अ डेली बेसिस. बटरफ्लाई पोजीशन आप कहीं भी कर सकते हैं, बेड पे भी, फोन पे बातें करते करते, टीवी देखते वक्त, तो आप इस बटरफ्लाई पोजीशन में बैठ सकते हैं. और अगर आप इसको एक्सरसाइज भी बनाना चाहते हैं तो यू कैन फ्लैप योर नीज अप एंड डाउन एंड यू कैन फ्लैप देम क्विकली, यू कैन फ्लैप देम स्लोली. सो ये बटरफ्लाई विंग्स के जैसे आपके नीज मूव करेंगे. थर्ड जो पोजीशन है वो है लेग रेजेस की. तो ये आप मैट पे ही करें, फ्लोर पे, बेड पे ना करें, डोंट डू इट ऑन द बेड. आप साइडवेज लेट जाएंगे, यू लाई डाउन ऑन योर साइड एंड जो अपर लेग है यू आर गोइंग टू रेज इट टू 90 degrees, राइट. लोअर लेग को आप थोड़ा फोल्ड करके रखें, कीप इट फोल्डेड, बिकॉज इससे आपको आपकी बॉडी को सही स्टेबिलिटी मिलती है. यू विल नॉट बी वॉबलिंग बैक एंड फोर्थ. सो अगेन स्टार्ट विद अबाउट 8 to 10 counts and you can increase to about 24 to 32 counts for each leg. जो नीचे वाला पिक्चर है राइट हैंड साइड पे, दैट इज कीगल्स. अब कीगल्स इज वन एक्सरसाइज जो कोई आपको दिखा नहीं सकता बिकॉज इट इज योर पेल्विक फ्लोर, वेजाइनल एक्सरसाइजेस. आपको इमेजिन ये करना है, आई डोंट वांट यू टू डू इट इन द बाथरूम, But just to imagine, आप use this picture. Imagine that you need to urinate. आपको pee pass करनी है, लेकिन आप के पास bathroom नहीं है. तो आप उसको कैसे control करोगे? तो जो muscles आप उसको control करने के लिए you are tightening, those are your pelvic floor muscles, and tightening and releasing them is your Kegel exercises. Kegels can be done at any time of the day. You can do them morning, evening, sitting, standing, in the car. Nobody will come to know. While cooking is very possible. You have to aim at doing around 75 Kegels every day, and you can break this up into 5-6 sets. So you can do about 10-12 every time. Last but not the least is deep breathing. With pregnancy के time पे breathing exercises are very important. So deep breathing से lung capacity बढ़ती है, abdominal muscles strengthen होते हैं. Over and above that, आप relaxed feel करते हो, calm feel करते हो. It's more like a meditative experience. So deep breathing, around 30-40 deep breaths every morning, non-air conditioned environment is what is recommended. हम मानते हैं कि full term is between 37 to 40 weeks. 9th month 35 weeks में शुरू होता है. Lot of people might say कि oh 9th month delivery is fine, but we want the baby to cross 37 weeks at least, and that is considered to be full term. अगर आपको कोई भी लेबर के साइंस 37 weeks से पहले महसूस होते हैं, दिखाई देते हैं, you should report to the doctor immediately. Doctors have options many times to stop or stall labor. If that is not possible, they can give medications to help mature the baby's lungs. And if nothing, and if the baby comes a little early, then there is the NICU to help the baby also. So don't sit at home and come in as an emergency case at the last minute. As soon as you notice some labor signs, please report to the doctor. What are the labor signs? अब लेबर कब शुरू होगा ये तो कोई नहीं बता सकता आपको. नो वन कैन टेल यू. एक होती है ड्यू डेट जो आपको अल्ट्रासाउंड में मिली है, जो पहले आपने LMP की वजह से मिली है, जो आपने पहले डॉक्टर को विजिट किया, डॉक्टर ने पूछा था आपका लास्ट पीरियड कब आया था, उसके हिसाब से देयर वाज अ डेट कैलकुलेटेड एंड गिवन टू यू. दिस इज कॉल्ड योर ड्यू डेट एज पर LMP. इसके बाद आपने अल्ट्रासाउंड करवाए हैं, सोनोग्राफीज कराए हैं, एंड हर सोनोग्राफी में देयर इज एन एक्सपेक्टेड ड्यू डेट जो अलग होती है. इट इज नॉट द सेम, वेरी रेयरली इट इज द सेम. सो दिस इज योर एक्सपेक्टेड ड्यू डेट एज पर USG, राइट. अभी तीसरी ड्यू डेट है which is expected due date as per the baby and as per your body. When does the baby want to become? And this no one knows. But some signs your body will start giving you. First is the baby's head will engage. So during the entire pregnancy, the baby is rotating, revolving, moving around, etc. And in the last 15 days, the baby's head enters into the pelvis and fixes. So you will feel that your stomach will visibly shift downwards. Braxton Hicks contractions will increase. Braxton Hicks contractions are fake contractions because they don't open the mouth of the uterus. Otherwise they are real. But because they don't have any action on the mouth of the uterus, we call them fake contractions. They are short, they are painless, they don't have a pattern, they don't have a rhythm, they are sporadic. So when you start feeling tightening of the abdomen much more frequently, then you can assume that labor is about 15 days away. Your doctor might do an internal examination and they can actually touch the cervix, which is the mouth of the uterus. And when they touch the cervix, they will be able to understand that the cervix is long and thick, or has it become short and thin. So if it is short and thin, we expect that labor is soon to start and the due date is approaching. But if it is long and thick, it could actually take some more time. Now this long and thick cervix starts becoming shorter, and about 48 hours prior to the onset of labor, you might lose what we call the mucus plug. Because the cervix is long and thick, there is mucus which blocks it. Once the cervix starts becoming thinner and shorter, this mucus plug falls out. So if you see mucousy discharge, sticky discharge on your underpant, you know that it is the mucus plug. You could also have some little bit of bleeding but this is very little. So reddish, pinkish, brownish, but in very, very small quantity, like streaks only, can be a part of your mucus. You might experience loose motions or multiple bowel movements. This is also completely normal. Lower back pain is not that dull, tired lower back pain. You will get intense spasmic back pain. So that is something which you can expect, which comes and goes. But in spite of all this, energy levels are at an all-time high. So you feel like cleaning the house, going shopping, going for a party if possible, because you have extremely high energy levels. Once labor starts, you are going to start experiencing regular contractions. Regular contractions which you will be able to time. So whenever you feel that, okay, I'm getting these contractions and they're coming again and again, use a paper pen, or you can use any of the apps which are available in on the Play Store and iTunes and etc. And start timing the contractions. Write the start, write the finish time. If there is a pattern, then it is most probably real labor. It feels like period cramps. The frequency and intensity, that means they'll come closer and closer together, will start increasing. If you move around and you are active during a contraction, you will feel more pain. When you have a contraction and you are resting, the pain will be lesser. So one of the quick ways of judging that you are really in labor is get up and walk around during a contraction. And if the pain increases, chances are it's the real thing. This is how we time contractions, because when you will call your doctor, the doctor will want to know what is the frequency and duration. Basis the frequency and duration, the doctor will advise whether you should come to the hospital or you should wait for some more time at home, right? So from the start of one contraction to the end of the same contraction is called the duration of a contraction. In between contractions, there is a period of relaxation. In early labor, this period of relaxation is very long. Once labor is almost done and the baby is about to come in the end, the period of relaxation becomes very, very short. So the other number that we are looking for is the frequency. So from start of one contraction to the start of the next contraction is known as the frequency. Now, generally mothers have this question, when should I go to the hospital? So my personal recommendation is when you find that your contractions are regular and they're coming approximately 20 minutes apart. But in addition, you should also ask your doctor as to what they are comfortable with. Sometimes contractions may not be there, but you start feeling that the water bag is broken. You start feeling a gush of liquid or a trickle of liquid from your vagina. That is your amniotic fluid. Even if there are no contractions, you should go to the hospital. If you are feeling scared or nervous, or your partner is feeling scared or nervous, then anxiety and stress is only going to make labor more long, painful, and difficult. So it is better that you both go to the hospital so you can feel more relaxed, more calmer, more safer, and it's okay if you go a little early. In case the hospital is very far away, it's traffic time, some major festival function, so then you should also consider going to the hospital a little early. Once you arrive at the hospital, don't worry if you do not see your main doctor. It's okay. The doctor who is on duty will check you. And if you are in labor, you are going to be admitted, and the doctor whom you have been consulting with will also be informed. So the doctor will be coming in and meeting you, checking you, making sure that you're comfortable. In the meanwhile, your vital signs like your heart rate, your blood pressure, your temperature, these are monitored by the nursing staff. Baby's heart tones are also checked, right? So we keep monitoring the baby on a regular basis because we want to make sure that the baby is not experiencing any kind of distress during labor. Labor will be allowed to progress naturally. That is how it works, right? So predominantly what happens is that whenever you are in the hospital and if everything is normal and okay, nobody is going to really do anything and labor process will be allowed to move as naturally and normally as possible. Now, labor we divide in different stages. So the first stage of labor is where the cervix is going to shorten, and this is called effacement. After this, the cervix has to open and is going to open to 10 centimeters. So this process is called dilation. In the second stage of labor, the mother's active pushing and the uterine contractions will help the actual delivery of the baby. The doctor is not going to do anything to pull the baby out, right? If at all you are stuck, then only other methods can be used. But if you push actively and the uterine contractions are powerful, the baby will slowly exit from the womb. So the journey of the baby from inside the womb to the outside world is classified as the second stage of labor. And then once the baby has been delivered and the umbilical cord has been clamped, the uterus will resume its contractions, and slowly the placenta will also separate from the wall of the uterus and will be delivered. The placenta has been your baby's life support system in this entire journey. And once the baby has been delivered, the placenta just becomes a redundant organ and is not required in your body. Many mothers don't even remember this stage because they're so busy looking at the baby, excited, relieved, want to be sure that everything is normal, that they forget that, third stage also happened. The contractions are there, but the contractions are, of course, milder. Now, let's talk a little bit about how to manage labor. It's important to remember my same old statement: stress causes pain. So more relaxed a mom is, that means there is less stress and hence there is less pain. The less pain that a mom experiences, the faster labor progresses. Now the best labor management tool is actually stress management. That is the whole key matter. So when we say labor management, we need to give you tools and tricks which can help to relax you and keep you calm. And then, of course, I call those tools and tricks my magic tricks. And if there were such magic tricks, wouldn't you be happy? So that's just what we are here to teach you today. Some amazing ideas, which are actually very simple, which you can do, which will help you to manage your labor pain a little bit more efficiently. Now, the first is avoid screaming. And to emphasize or explain this point better, I would like all of you to do one simple exercise with me. Close your eyes, sit back, feel your facial muscles, keep them neutral, and think about what your vaginal muscles feel like. Okay? Now, change your facial muscles to a frown, make a nice grumpy expression, and think what your vaginal muscles feel like. Right? Changed. Now, the next thing you're going to do is at the count of 3, you're going to scream. 1, 2, 3. Think what your vaginal muscles felt like when you were yelling and screaming. The last thing I want you to do is just relax and smile. Nice big smile. And now think what your vaginal muscles feel like. So it's really simple. Your jaw and your vaginal muscles are pretty much in sync. So if you are screaming and you're tightening up your body, your vaginal muscles also get tight. So that becomes a detriment because from there is where we're going to deliver the baby, isn't it? If I'm not going to scream, then I'm going to breathe. And labor breathing can be a little different, not the deep breathing. Now what we're going to practice is short breaths. So sit back and practice this with me. Place one hand on your chest, place the other hand on your abdomen. Prepare yourself. Imagine that a contraction is coming on. Take a deep breath in. Exhale. Now switch to short breaths. Breathe in through the nose, blow out through the mouth. Just short breaths, which is going to look like this. So when you're doing this, the hand which is on your stomach will not be moving. right? Wonderful. And then the contraction disappears. So take a deep breath in and relax. Now this is your period of relaxation, which means you have to let your body go loose, limp, relax, calm, and just recover. Don't get stressed. Don't think how bad the contraction was and oh my god, where have I reached? How many more contractions? Don't panic about all those things. Just relax. Let's try it one more time. You can feel a contraction coming on. Take a deep breath in. Exhale. Breathe in through your nose, blow out through your mouth. And the contraction is disappearing. Take a deep breath in and relax. And you're in the period of relaxation. Okay. I have done very short contractions for as a practice run with you. What I want you to do is keep a clock in front of you if you're 28 weeks and beyond, and every day practice 5 such contractions, considering that each contraction lasts for 1 minute. So you're doing your breathing for a minute, and each period of relaxation lasts for 1 minute. So in the middle, you're kind of, letting yourself go loose and limp for 1 minute. And then again, you practice your breathing. Again, you do the period of relaxation, and you do 5 such cycles. So you can keep the clock in front of you. You can have, your partner do the timing for you, whatever works. But daily practice starting from your 28th week onwards is important, because when you're doing it as a practice, you're able to manage it better when you are actually in labor. The next thing that you have to do is you must visit the bathroom. Why am I visiting the bathroom? Because remember, we have multiple bowel movements prior to the onset of labor. So your bowels are empty. On the other side of the uterus is your bladder. If I visit the washroom every 45 minutes to an hour, then you will be able to, have more space for the uterus to evacuate the baby. There will be more space in the birth canal. So, and plus also you'll tend to relax, right? You'll sit with your legs a little wide. You will have to kind of loosen your body out to pass urine. So don't worry if you are, you feel that I don't really feel like going to pass urine. Just go and sit on the pot for a couple of minutes. That will help to relax your lower body and your pelvic floor muscles. Try to be in an upright position, because this is going to give you the advantage of gravity. Also, your birth canal is slightly tilted upwards when you're lying down. So when you sit up, जब आप उठ के बैठते हो, so your birth canal, it becomes tilted forward, and that will give a good slide to the baby. Not necessary that you have to sit all the time during labor. You can lie down when you feel tired, but do try to keep sitting up also. Last but not the least is movement. And you have to think like this, the uterus is a pillow cover and the baby is the pillow. If I have to remove the pillow from the pillow cover, even at home, what do? I will shake it, move it, pull it, tug it, do some action to it, right? Provide some movement to it. And that is exactly what we need to do. So you can walk, you can kind of, do some squats, you can sit on an exercise ball, you can sway, you can go up and down the stairs, depending on what is available to you at that point. Provide some movement which will help the baby to move down much more faster. Massage can also be used effectively during labor. It can be very relaxing, and especially since you're getting all these spasmic lower back pains, it can become uncomfortable for the mother, and therefore doing a little bit of a gentle massage in the process at the lower back during a contraction in this fashion, in this location, can be very helpful for the expecting mom. Shoulder and neck massage is always highly appreciated by anybody, and that is where we take maximum tension in our body, right? So giving the mother a gentle shoulder and back massage, neck massage, can help to reduce her stress levels. So, she'll focus on the massage and she'll not really get stressed too much about the contractions. Some mothers like to get a gentle effleurage kind of a massage on the abdomen. This is also going to be as per the mother's wish, right? So you can check with the mother if she would like to get a little gentle stroke on the abdomen. Main point with massages is that the massages can't be very, very intense. For any of the massages, you really can't be like, pummeling the mother, and it should be a continuous movement or continuous massage during a contraction. So you can't massage for half the contraction and then, I'm tired, take a break and then go back to massaging her. She's going to get more uncomfortable. So you should maintain a constant touch during a contraction. Once the contraction is over, the partner who's doing the massage can stop and take a break and relax the fingers and, etc. Natural pain relief options, right? So you should relax. That is something which is very, very important. Practice your breathing exercises. Massage can be helpful. You can practice imagery, which means, you kind of imagine beautiful thought processes, your favorite holiday, your most happy moments, maybe remember the first Valentine's Day that you spent with your partner. So, focus your mind on these very positive images that you may have from your life. And then there's, of course, diversion techniques. So diversion can be maybe watching your favorite TV show, listening to some relaxing music, chanting, playing, the counting beads on your as a religious option. So whatever helps to distract you or divert your mind. It really depends on each mother what works for her. So it's not that one thing is going to work for all. You have to see what kind of person you are, and accordingly you will be using that diversion technique. Eating and drinking is always a question mark during labor. So before you decide to kind of have a 7-course meal in the hospital, please check with your doctor. It is essential to stay hydrated. So you can keep sipping on water or you can suck on ice chips. So it hydrates you and it also keeps you cool because you're in labor, you're burning a lot of calories, your body is really heated up. So these things will help to keep you cooler and it will keep you hydrated. High sugar foods in small tiny bits like glucose water, sweets, glucose biscuits or small pieces of chocolate can also be absolutely helpful. Eating large meals may actually cause vomiting, and this can also be risky before a surgery, right? In case you have to have an emergency surgery. So that is also something that you should kind of, check in with the doctor, whether you can have a proper meal or not. Many times, in the hospital, if the mother is in labor, she is given very light meals. If everything is normal, they just probably give her some khichdi or some soup, something light to keep her energy levels up. There are some medical pain relief options that can be considered. One is an epidural analgesia. So you can discuss with the doctor. Epidural is very commonly and popularly used for all lower body surgeries, and the advantage is that it helps to keep you awake also. So you are awake during the procedure, and as soon as the baby is born, you can breastfeed the baby. You can so it's good for long labors. It's good for labors where it's very painful, or if mothers are very anxious and stressed out. So this is an option that you can discuss with the doctor so that you are aware of what the process is in your hospital. A spinal block is generally used for cesarean section births. That is something which again is going to be the doctor's choice. Entonox is more like nitrous oxide or laughing gas. This is used more for short-term pain relief. So, maybe you're almost ready to deliver, but you are feeling a lot of discomfort now and you've not taken any other pain relief. So sometimes the doctors can suggest that you take this. It's not available in all facilities, but you can check on this with your doctor as well. A surgical birth, that means a cesarean section, is done because of two things, two categories we could say. One is it's a planned C-section, which means there is a pre-existing condition. So this could be the baby's position, the placenta position, some issues like maybe gestational diabetes, excessive hypertension. So these could be surgical births which are planned. The doctor says, it's too risky to do a vaginal birth. Let us plan a date and we can kind of, deliver the baby on that date. The date that is selected is generally just a few days before your actual due date. Unless the baby is not getting adequate blood flow, the nutrition is not proper, the baby is severely small for gestation age. So then the doctor might not want to wait because the baby is not happy inside, the baby is not getting enough nutrition inside. Now, there is unplanned dose, which means that things which happen during labor, which nobody can predict. So many times mothers feel, oh, my whole pregnancy was normal. I even went into labor, everything was okay. But still, I had to have a C-section. Why? Right? The cervix, which we spoke about, is going to dilate to 10 centimeters, may not dilate. So you may have contractions, but no effect on the cervix. The cervix is fully open, but the baby does not move down. Even though you're practicing all your breathing exercises, the baby is still not getting enough oxygen and is showing signs of fetal distress. Maybe the mother develops an infection, so the mother's body temperature is rising, so we cannot keep the baby in that environment. You have to remember, a surgical birth is always done to save lives. It should not be taken as an option of convenience. That, oh, this date is very auspicious, or I like this date, or this is convenient because my mother can come now. Those are not reasons for a cesarean birth. There is such a beautiful, cute picture. I took some time to actually, decide which picture I want to put on this slide because I wanted a baby which was really, really cute. Right? And the whole idea is that when you look at something so cute, the first thing that happens is you go like, oh, you have a smile on your face, right? So this is exactly what we are looking forward to. A beautiful beginning. So welcome it with positivity. Do not look at it as a dreadful thing, like, oh my God, labor. We don't have to think about it like that. We have to think about it with a smile on our face because it is going to bring this beautiful baby into our arms.
When is a parent born? When your world changes in a moment. Nani? Or when the moment is celebrated by all. When you start learning again. Or with a new role. Is it your child's first breath? Or is it just a feeling? Parents are born when they fulfill a responsibility.
Your child's umbilical cord blood can provide protection from 80 life-threatening diseases. Keep it safe with Asia's largest stem cell bank, Cordlife. One chance, one choice.
For all my lovely moms who've been attending the session today, we have a special gift for you. This has been brought to you by Cordlife and Life in Pursuits. It's a 25% discount voucher, which will allow you to indulge yourself and purchase products which are manufactured and sold by Life in Pursuits, which are organic and natural in nature. So these could be massage oils, body washes, etc. And you can pick these up for yourself. You can pick up for your baby. And this is something which is an opportunity which will be good for you to take. So the Cordlife team will be in touch with you soon after this session in about 48 to 72 hours. They will be sharing the recording of this session as well as this voucher. At that time, if you would like to learn more about stem cell banking, you can also request to book a personal session, which is completely free of cost. And the Cordlife team will either do a Zoom call with you, or if you prefer a personal visit to understand more about stem cell banking and ask all your questions, you can take that opportunity as well. These are some of the books that are available in the market, which I have written. I have prenatal fitness, which is exercise during pregnancy and postpartum with pictures and explanation. Parenting mantras, which talks about life after the baby. So from breastfeeding to toilet training to sleep training to, finding time for yourself. These are all tips that we have created here. And then we have the Super Moms recipe book, which has recipes which you can try with your child when they start eating solids. Now the floor is open for questions. I would suggest that you take a screenshot of this particular page because it has my personal coordinates, my Facebook and Instagram handles. Please do follow us. We do a lot of fun stuff on these pages, and a lot of ask me a question, Q&A days, videos, etc. I also have a YouTube channel, and if you would like to be in my free pregnancy tips group, then you can drop a WhatsApp message to this number. My team will add you to it, and you will receive a tip of the day every morning in your WhatsApp. The numbers in the lower half of the screen are all of Cordlife. Please make a note of those as well. You have a calling number, a WhatsApp number, a toll-free number, and an SMS number. So the screenshot of this page can be really valuable because then you can kind of, get your gift voucher, recording of the session, and also maybe, take a appointment to understand all about stem cell banking as well, right? So we're ready for your questions now. In the question box is what we are looking at. All right, so I have a compliment, so thank you so much. I'm glad that you're feeling relieved and you've enjoyed the session where you've been able to pick up tips, and I'm sure that you will practice them and meticulously and diligently and have an amazing birth experience. So another compliment, thank you so much. I'm glad you found the session informative. The question that this mom has is, any risk regarding epidural you can guide as well. So, the downside of an epidural is that you should not take it too early. That means you should not take it before you are about 2 to 3 centimeters dilated, because at that time labor can stop and we can still send you home. Right, but if we've started the epidural, then we are not able to send you home, and then we have to induce, augment labor, so that can, just make things more artificial. In the last stages, at around 8-9 centimeters also, you should not take the epidural, because the other downside is that because you're numb, you may not be able to feel the contractions, and pushing the baby might become a challenge, which could then result in an instrumental delivery. It does not cause, permanent back damage, lower back pain. It doesn't do all that. In fact, back pain post-delivery is caused because of incorrect breastfeeding postures, and it is blamed on the epidural. It can cause a local infection. It does cause blood pressure fluctuations. So your blood pressure will need to be monitored. And that is why the anesthetist will be monitoring you constantly. So that is also something which is managed really well. Because of the blood pressure fluctuations, you may have a little bit of edema or swelling, and this can make even the breasts a little swollen. So it could take maybe a little while for the baby to latch, and that could be one of the downsides. But otherwise, we don't have any long-term side effects. But because we have these small ones and they are short-term, it should be taken if you feel that labor is long, labor is painful, and if you're going to go through a really long and painful labor, at the end of the whole thing, you're going to be so exhausted that you're not going to enjoy the baby. So it is better that you kind of, then take the epidural and enjoy the baby. So it's a decision that you would make once you go into labor, not in advance. Okay, so the next question is, if we have a low-lying placenta, which is about 2.6 centimeters away, what should we do? So a low-lying placenta depends first and foremost on which week of pregnancy you are in. If you're in early pregnancy, that means in the 0 to 20 weeks phase, where the low-lying placenta has been observed at 2.6 centimeters, we can expect that the placenta, because of the growth of the uterus, will also migrate a little bit. So it will move to the upper part, right? The other thing that you have to be careful with is that have you had any spotting or bleeding incidences? If you have had no spotting or bleeding incidences, then you can have a normal lifestyle. You can continue doing some walks and etc. But you should not do squats and any exercise which puts pressure on the pelvis. But at 2.6 centimeters and 18 weeks, definitely by the time you're about 24 to 28 weeks pregnant, we expect the placenta to be much higher up, and then you will be able to start all the antenatal exercises. So the doctor will be reviewing the case on a regular basis. Ma'am, how to control high blood pressure issues during labor pain or in the 9th month? See, so now if you have high blood pressure, hypertension during pregnancy, and if it's really high, the doctor is going to give you medication to control it during pregnancy. And it is important that you take this medication because the high blood pressure can actually impact the placenta. It can cause placental separation also. So the medication is given. The same will be also followed during labor. If you have a history of hypertension, or if while monitoring your vital signs, the doctors feel that your blood pressure is rising, so then they will medicate you to bring the blood pressure down. And if it is not coming under control, then they will have to deliver the baby surgically because they don't want to take a risk. If the placenta separates inside the uterus, it's one of the biggest risks, right, for the baby, because the baby's oxygen supply gets cut off. So once the baby is delivered, the placenta has to separate, but it should not separate before. And elevated blood pressure can be one of the reasons. So if the blood pressure is elevated, medication is recommended. Otherwise, if it's mildly elevated, then you can consider cutting back on your salt. You can kind of do some gentle exercises like walking, etc. These will help to control the bring the blood pressure into normal ranges. Relaxation, meditation techniques, when people are very stressed or anxious also, blood pressure tends to rise. So it's again a case-by-case answer. Any further questions? You will be receiving a link. I've already got an amazing feedback for the session, so I want to ask for more feedback. Thank you so much. It's a great learning experience for us when you people give us feedback, so we know that the sessions are effective. The Cordlife team will also be sharing a link where you can give your session feedback. You can also stay in touch with the team to know when other sessions are happening. So accordingly, you can also take the opportunity and attend those, because different topics are conducted. Today was labor. We can have other topics related to pregnancy and birth as well. So you've been a really amazing audience. Once again, thank you to Dr. Aditi for giving us this opportunity and allowing us to speak to all the mums. I hope I could do justice to the session and I lived up to expectations. Thank you to the Cordlife team for taking the initiative and having this amazing platform and ensuring that there has been no break in the content sessions which were being organized for pregnant mothers, even in spite of the pandemic. Okay? So thank you everybody for all your valuable time on a Sunday. Thank you.
When is a parent born? When your world changes in a moment. Nani? Or when the moment is celebrated by all. When you start learning again. Or with a new role. Is it your child's first breath? Or is it just a feeling? Parents are born when they fulfill a responsibility.
Your child's umbilical cord blood can provide protection from 80 life-threatening diseases. Keep it safe with Asia's largest stem cell bank, Cordlife. One chance, one choice.